Hello, my name is Anne Jones. I'd like to introduce you to the Action on Cancer Toolkit. The toolkit is now live on the Cheshire and Merseyside Cancer Alliance website and is pretty self-explanatory. But I'd like to give you a little background and encourage you to take a look for yourselves and, most importantly, share it with individuals or groups in your networks for use in their own localities across Cheshire and Merseyside. This is what I'd like to touch on today. Give you a bit of background to the Action on Cancer work that started in Central Cheshire. What were the main messages, lessons learned and principles to share with others via the Action on Cancer Toolkit. Then give you a peek inside the toolkit itself, what it looks like and who it's aimed at, so that you're fired up to share and signpost. Action on Cancer was born when in Central Cheshire, our public health consultant, CCG cancer team, respiratory consultants, lung CNSs and radiologists got together with local Macmillan and Cancer Research UK colleagues. They saw stark data of too many people in Crewe being diagnosed with lung cancer late, having poor outcomes, often after emergency presentation. People think of Cheshire, they think rich footballers, millionaire business people, wealthy farmers, nice villages. And when you look at the Cheshire cancer or other health statistics as one lump, then everything might seem pretty rosy. But there are significant issues in significant pockets, like Crewe, where every single negative health and deprivation box is ticked. Important work was done in the hospital to refine the diagnosis and treatment pathway, including introducing a new self-referral chest X-ray service in 2015. But we needed to get people in earlier. How to do that? Well, not telling people from a distance. People have been told from a distance for years. It meant being where people were at, involving them in the conversation, speaking in their own language. Even though we were a team who had enthusiasm, commitment, communication skills and passionate clinicians, we had the information and the data, and we knew we needed to start small and targeted. One person couldn't talk to everybody. So we got real local Crewe people in from the start. And a very significant part of the work was done by Crewe people themselves. They became the lung champions, and from then on, wider Action on Cancer champions. They confidently and passionately spoke with their friends, neighbours, colleagues, networks. They shared the positive stories, they shared the social media messages, and they kept the passion going so we could keep building. That's why the toolkit stresses the need for passionate local champions and strong partnerships. And often those partnerships may be with pretty unexpected groups and organisations. Yes, primary care played a vital role. Yes, we worked with our council engagement teams and with cancer support groups and local health organisations. But we worked with the fire brigade, with Meals on Wheels service, with the local library, the leisure centre, care homes, men in sheds, local Rotarians, art groups, knit and natter ladies, YMCA, business groups, railway union, schools, Salvation Army, churches. I could go on. What are the lessons does the toolkit share? Well, being different works, and stopping people in their tracks, being eye-catching, colourful, even humorous, and positive messaging. We want to keep lungs healthy, not you'll get cancer if you don't quit. Being flexible and responsive, but organised and focused at the same time. Not ignoring opportunities, but always coming back to your data and your priorities. This is a slide of the overriding awareness messages we kept coming back to, whatever the format or context of our particular activity. This is what the toolkit stresses: know your audience and know your message. You may change how you say it and what your main stress is depending on who and where you're talking. Hopefully you can see the positivity in these, and I make no apologies for the bright colours. So we had a prevention lifestyle change message. We had a message around the importance of early diagnosis and what people could do for themselves. Why did we create this toolkit? Well, not just to look pretty on a website, but to be used. To give passionate people the confidence and some tried and tested practical tips to taking their local data, responding to the local picture, and start talking cancer, making a real difference to the cancer outcomes in their own communities. To avoid the need for everyone needing to reinvent the wheel. What does it look like, this toolkit? Well, I presume you've guessed by now that it's pretty colourful and eye-catching, not quite like your usual NHS booklet. It's along the lines of all the action on cancer materials and resources developed in Central Cheshire over about 5 years. It's easy to read and dip in and out of. It's written in practical, constructive and upbeat language of top tips. And it links and signposts to a lot of additional resources, guidance and support. If there is good stuff available, we don't recreate it. We use, celebrate and point people to it. Who's this toolkit for? Well, anyone who wants to make a difference in their community and share cancer messages in a relevant, impactful way. Maybe public health or cancer professionals, but these people are unlikely to have the time and capacity to be doing the doing in terms of engagement. So it's more likely to be someone or a team of someone's on the ground who want to make some changes to the numbers, but don't know where to start. So it could, for example, be someone in a local CVS or a large local employer. The toolkit's not really aimed at the public health specialist or the community engagement specialist, but for someone who wants to use both of those colleagues and all their other local partners. It should help that person or team to learn from how things have worked in a local community elsewhere and apply that learning in the practical way based on their own local data, their own local priorities and their own local landscape. What I'd like to do now is take a quick flick through the pages of the toolkit for you. So I've just cut and pasted some sections straight out of it. Firstly, it talks about having someone in place, and it could be a team, to drive the cancer awareness work forward in the locality. Probably not a CEO or a busy clinician, but someone on the ground who knows the community already. There's a link there in pink to a job spec to give some tips on the kind of person who'd be ideal to drive the work. The toolkit stresses how important understanding your local data is and what story it's telling you so that you can keep focused and make the most of your precious time and resources, make the biggest, most significant impact on cancer outcomes in the shortest time. Then it talks about the audience. Knowing your local data will tell you who your target audience is. And here the toolkit suggests spending some time creating a set of personas. If you do this, if you really get to know Harry head in the sand, then you're more likely to know where you can find Harry, what's important to Harry, how best to get Harry to listen to your message, and which of your community partners can best meet Harry where he's at. What to say and how to say it. As you can see, the toolkit really encourages drawing attention. We never hid from the word cancer. It's a word that's quite daunting and scary for a lot of people, including professionals. But the learning shared in the toolkit stresses always trying to be positive and engaging. So helping to open up and normalise the conversations around cancer and what people can do for themselves to reduce their risk or to get an earlier diagnosis with potentially much better outcomes. A lot of what we did from 2015 to early 2020 was physically out and about, talking to groups, mingling right at the heart of our community. Not just in health settings, expecting people to come to us, but everywhere we could think of or get invited to. And we went to all sorts of places and events. COVID-19 has made things tricky, obviously. Our social media presence was always a big part of what we did. Twitter started stronger, whilst Facebook took a little while, and we learned as we went along. And as with everything else, partnerships made a big difference to our social media presence. Because you don't just want to be talking to your easy audience, your obvious supporters. Get them to talk to their friends and their audiences, and get them to talk to their friends and their audiences. What about those who don't do social media in this new isolated COVID world? Well, what about that newly formed Zoom Knit and Nutter Club or the online Rotarians meetings? Get yourself invited to these. If they were happy to have speakers for real in the past, they'll be just as happy to have a virtual speaker, as long as you're interesting and engaging. With some relevant training, support and guidance, a local champion's invaluable. The toolkit talks about the kind of people who'd be great as champions and how to build them. It goes on to give some examples of who might tick that great champion box. And they certainly don't all need to be clinicians or cancer specialists. But the toolkit also encourages finding ways to use our health professionals in the broadest meaning of that term as champions. We're not just talking GPs or cancer nurses. The toolkit signposts to proven techniques like MEC, making every contact count, or VBA, very brief advice. And it has examples of simple AOC workshops for this group. It encourages working with all manner of frontline professionals, like receptionists, care staff, pharmacists, to take advantage of quick, teachable moments where they can feel more confident to share positive lifestyle messages and stress the importance of early presentation in the context of cancer. Everyone is strapped for time. It's an incredibly rare commodity. So clever use of time, for example, when planning social media messaging or other comms messaging, is essential. It might sound counterintuitive, but if you put in some time and work into a bit of clever organising, you will avoid unnecessary stress and wasting precious time. And the tips given in the toolkit, they're not rocket science, but they are there to help get things started in the right way. The toolkit next talks about how strong community partnerships not only help to share awareness messages successfully with particularly difficult to reach groups or target audiences, but those strong community partnerships can sometimes open the door to funding pots for growth and future sustainability. Action on Cancer in Central Cheshire got really creative in terms of our resources. We were not flush with cash. We were awarded some very small targeted funding pot from our local town council, and it was specifically to support practical awareness activities in the town. This paid for a local art group to create very unique resources, which were invaluable to start conversations about what might be pretty difficult topics, but in an unthreatening, even humorous way. So the message in the toolkit here is be creative. The other important thing is evaluation. When your cancer data is often not available for a couple of years or more, evaluation based on that data can be tricky. And when you think about it, the result of a positive, individual, healthy lifestyle change might not be seen in improved cancer outcomes for many, many years. But you can still log how many people you're talking to, how many activities you've been involved with, and you can record those precious personal stories of what people say the impact has been on them and their loved ones. Those stories may be what makes a difference to being awarded funding to keep going. The toolkit finishes with a process on a page Not a formal project management system with loads of forms and documents and reports, but quite simply a step-by-step checklist. I hope this whistle-stop tour has given you a bit of an idea of what the Action on Cancer Toolkit's about, and you'll go onto the Cheshire and Merseyside Cancer Alliance website to have a good look at it for yourselves. And you'll talk to everyone you can think of about it across Cheshire and Merseyside. It's no good unless it's being used. Thank you, folks.